Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
So my name is Savannah. I am one of the oncology dietitians with Northside Hospital. And appropriate for Survivor Month in this talk today, I'm also their survivorship dietitian. So this is really what I specialize in, is life after cancer diagnosis and treatment. So that's what we are going to talk about today. All right, so to give you guys an overview of what we're going to cover, we're going to start off by touching on the role of nutrition in the survivorship stage of our cancer journey. We're going to review some practical tips for implementing the cancer fighting diet. We're going to cover a couple common questions about dietary supplements. And we will also provide some strategies for some potential longer term symptoms that might follow a cancer treatment. So without further ado, let's get into it. So, why exactly is nutrition important at this point? Throughout the course of our life, our nutrition needs change. Of course, they're going to be different as a baby to being a teenager to being, you know, an aging person. And then that's going to become a little bit more specific when we throw in any kind of chronic disease. And cancer is no exception. If you have been paying attention to your nutrition since the start of your cancer journey, you maybe have seen that your priorities and your goals have changed. At this point, when we talk about survivorship in today's session, we're mostly going to be referring to post-treatment, whether that is chemo, radiation, or perhaps surgery. So we're going to be talking about once your primary treatment is over. Maybe we're considered cancer-free, or maybe we're going to be on some kind of long-term surveillance or medication plan. At this point, your goals can be really individualized. Perhaps it's to prevent additional cancer diagnoses from cancers that are linked with diet and obesity. Or maybe we want to reduce the risk of your current cancer recurring. Or maybe we're more practical and we're trying to manage some side effects that are lingering from chemo or radiation. You might be wanting to manage a healthy body weight. Perhaps during your cancer treatment process, you lost a lot of weight and you're looking to gain it back. Or maybe it's the opposite and you're hoping to lose a little bit of weight to get to a healthier body weight for you. We also might just be looking to have overall optimal health to reduce the risk of additional chronic disease developing or to support our immune function in healing after treatment. So there's a lot of directions that we can go in with nutrition and survivorship. Of course, today, just talking for about 45 minutes, so we can't deep dive into every single one of these things, but I'm hopeful that we can kind of come up with a baseline of some information for this stage. When it comes to reducing the risk of cancer recurring or developing an additional cancer, there are, as you can see on this slide, about 10 key recommendations put out by the American Institute for Cancer Research. So these are kind of going to tee us up for the rest of the recommendations today. Now, I will say I'm going to go over this slide and read out these recommendations, but we're actually going to do a deep dive into these recommendations next month in the Reducing Risk series. So tune in July if you want to hear a little bit more about this. The first session of that basically dives into this slide more in depth. But for today, let's just go over these recommendations. The first one is to help reduce cancer risk and recurrence. We want to be a healthy body weight. So we will touch on this a little bit on the next slide. We also want to be physically active. We want to eat a diet rich in whole grains, vegetables, fruits, and legumes, while simultaneously limiting consumption of fast foods and other ultra-processed foods that might be high in saturated fats, refined starches, or added sugars. We want to limit our consumption of red and processed meats and also limit consumption of sugar-sweetened beverages and alcohol. We'll touch on supplements later in this presentation, but we do want to be conservative with our supplements and avoid using them for the purpose of cancer prevention. And if this applies to you, if you're an expecting mom, we do know that breastfeeding our baby can reduce the risk of developing breast cancer. And lastly, what they recommend is that after a cancer diagnosis, which is probably most of us here today on the call, we want to try to follow these recommendations as closely as we're able. Of course, there might be some caveats. You might have some restrictions, particularly if you dealt with any kind of GI related cancer, whether that's head and neck cancer all the way down to colorectal cancer. You might be experiencing some limitations that affect what you're able to eat right now. So maybe a super high fiber diet isn't for you at this stage in your journey. But what we want to aim for is incorporating these recommendations as closely as we can. So let's talk about the link between obesity and cancer risk. So, second to avoiding tobacco products, being at a healthy body weight is one of the biggest things that we can control to help prevent a cancer or cancer recurrence. We know that being overweight or obese, or having higher body fat composition, in other words, is linked to at least 11 cancer types. And you'll see those 11 cancer types here on the screen. But I do want to highlight that the most common cancer types, which are breast, prostate, and colorectal cancer, are linked to overweight and obesity status. Unfortunately, we know that 7 out of 10, Americans are either overweight or obese, so almost 70%. And only half of Americans are aware that there is a link between obesity and cancer risk. So hopefully after today, maybe a few of you, this is new information, we can budge that percentage just a tiny bit, is always the goal. So, managing a healthy body weight is going to be a big part of the survivorship stage of cancer. And again, maybe for you, it's not so much about losing weight as it is getting back to your healthy body weight, maybe feeling stronger, more energized after treatment. A lot of the recommendations that we cover today are going to help us support a healthy body weight. So that brings us to the standard American diet. So the standard American diet is basically what we call the diet that's most prevalent here in the United States. Unfortunately, it is linked with obesity and increased chronic disease risk, and that does include, of course, cancer. So, what is the standard American diet? Really, you might hear it referred to as a meat and potatoes diet. There's a big emphasis on meat as protein, as well as our refined starches. So things like white breads, white pastas, anything from a refined white or wheat flour, as well as some of our other starchy vegetables like potatoes and corn. Typically, this diet has only small amounts of vegetables and fruits, but it does include a lot of saturated fats like butter, cream-based dishes, full-fat dairy, and of course, all of the saturated fats that are found in processed foods. The standard American diet also typically includes sugary beverages and alcohol. Now, you might not follow all of these, points here, but I would just take a moment and think about, is there any part of the standard American diet that sounds like it is a good descriptor for your diet? So maybe for you, that's, I'm not eating a lot of fruits and vegetables. That's a good thing to keep in mind. Maybe write it down, and that's a great starting point for something to work on. So instead of the standard American diet, what do we want to eat? Well, the American Institute of Cancer Research came up with what they call the New American Plate. So this is based off of those 10 recommendations we looked at a couple slides ago. On the New American Plate, about 2/3 or more of the plate is going to come from whole plant-based foods. Now, that's not just fruits and vegetables, although of course that's a huge part of it. It's also going to include things like your whole grains, your nuts, your seeds, beans, and legumes. So a whole host of plant foods beyond just your fruits and vegetables. The New American Plate also includes about 30% of it coming from animal-based protein, whether that is your poultry and fish or maybe dairy and eggs. Now, just like the standard American diet, this can be customized to your preferences. So if you prefer to have all plant-based protein or maybe a pescatarian diet, there's a way that you can implement this and still get a lot of the benefits of the New American Plate. We also recommend limited processed food intake, as those are typically higher again in things like added sugar and saturated fats, which can make weight management a lot more difficult. And we recommend minimal alcohol intake, as we do know that alcohol is a carcinogen and it's linked to at least 6 different cancer types, but probably more than just those 6 we've identified. The plate is also going to include a healthy source of fat like olives and olive oil, nuts, seeds, and avocado, to name a few. Okay, so I really like to focus on this New American Plate because it helps us to think about what can we add in as opposed to what do we need to take out of our diet. So in the next couple of slides, we're going to go over some practical tips for getting started implementing the New American Plate. But again, I just want to send a reminder, if this is something that you really would like to focus on, the second session of the Reducing Risk series that takes place next month with the cancer support community will go through this a lot more in depth. So again, feel free to tune in for that one to go over this more in depth. Okay, so on this slide, I've created some practical tips for introducing higher fiber grains. So on the standard American diet, there's a big emphasis on refined grains, like I mentioned, white breads, white pasta, things like that. Well, what we know is part of the benefit of eating a lot of plant foods is the fiber intake. Higher fiber diets are linked with reduced cancer recurrence or reduced cancer development in general. Our whole grains are going to be our higher fiber carbohydrate options. So whenever possible, we want to choose whole grain, high fiber breads. To help us identify those, we can look for words on the packaging, such as whole grain or whole wheat flour, and be aware that enriched flour is not considered a whole grain. So enriched flour does not necessarily mean high in fiber. Other non-bread sources of whole grains are going to include things like quinoa, brown rice, whole grain pasta, oats, rye, and barley. So there may be an opportunity to try preparing foods or creating dishes with some of these whole grains as opposed to maybe some of the grains that you would have used in the past. You can also look for this whole grain seal. So that's what this picture is of this little yellow label. Many, but not all, whole grain products will choose to include this seal so you can more easily identify if it's considered whole grains or not. Another way to enhance the fiber of some of your carbohydrate foods is to add in something like fruit. For example, a cereal or an oatmeal in the morning is a great opportunity to throw in a handful of berries or banana or whatever fruit sounds good to you to help bump up your fiber intake. So, some other tips in order to help us create more of a plant-centered focus are going to be feel free to rely on frozen vegetables and fruits for convenience. They will have just as many nutrients as fresh foods because they're picked at peak ripeness and then frozen and they retain their nutrients when they're frozen. So if a barrier to, for you or your family is that your fruits and vegetables just spoil too quickly, or maybe you live farther from a grocery store, it's hard to go get them fresh every week, you could implement them through the frozen variety. You can also use canned beans. That makes it an easy way to get some extra high fiber, even a plant-based protein into your diet. I recommend storing some canned beans in the fridge, or excuse me, in the pantry. You pop it open, rinse it well under water until it runs clear to get rid of any extra sodium they may have put in the can. And then it's great to add to things like salads or soups for a little extra protein and fiber throughout the week. Instead of using condiments like mayo and mustard, you could try using an avocado or hummus to sneak in some more plant foods. And you can also make things simple for you, especially if you're still feeling a lot of fatigue from cancer treatment. Go ahead and buy a pre-cut veggie tray, maybe something like a party platter that you would take to a potluck, and keep it in the fridge, and you can use that for some quick snacking options or to easily, throw in a steamer to heat up or add to salads. Ultimately, we want an abundance and a variety of our plant foods. A great way to focus on variety is to make sure that you're eating the rainbow. A lot of the color that comes in our fruits and vegetables is actually a result of certain phytonutrients, so things like our polyphenols and our antioxidants. A popular one most of us know about is lycopene. It's the polyphenol that gives tomatoes their red color. And we know that lycopene has some anti-cancer benefits. For example, it's linked to reduced prostate cancer risk. That's just one example of how the color in our plant foods helps benefit us and ultimately helps fight inflammation and reduce cancer progression. So things like your leafy greens, your brightly colored peppers, berries, onions, purple cabbages. If we can get a variety of color on our plate that's coming from whole foods, usually we're able to get in a lot of great nutrients. Okay, so what might give some of us trouble is if we're big meat lovers. When we talk about the new American plate and being more plant forward, that does not necessarily mean we have to go vegetarian or vegan. There still is a place for animal foods in this diet. We just want to be a little bit more mindful of what we're choosing. So, step one would maybe look for leaner cuts of meat that are going to have less of the saturated fats. This might also help with weight management because some of the higher fat meats are going to have excess calories. A typical portion of meat is about 3 ounces, or the size of a deck of cards or a bar of soap. Now, this is a starting point. Depending on your needs, you might need more than 3 ounces of meat per meal in order to be satiated or in order to hit your protein goals, especially if you're trying to rebuild muscle. But there's a good chance you probably don't need quite as much protein as maybe you've heard in the media, maybe saw on Instagram. Right now, very, very high protein diets are trending. You do want to try to eat more white meat than red meat and limit red meat to 18 ounces per week. We do see a correlation with higher rates of colorectal cancer when we're eating more than 18 ounces of red meat a week. When we're eating less than 18 ounces of red meat, we are not seeing a correlation with colorectal cancer rates. You will want to avoid processed meats like our deli meats, pepperoni, hot dogs, sausage, bacon, as much as you can, as this is a known carcinogen. It's specifically, again, linked to colorectal cancer. And while we don't fully understand why all of the processed meats are carcinogenic, we do know that nitrates and nitrites are contributing. So, at the very least, I recommend looking for nitrate and nitrate-free processed meats. But again, there might be some other components that are still contributing to cancer risk. It's also great to substitute meat with fish, especially our cold water fish like salmon or tuna. Those are going to be high in our anti-inflammatory omega-3 fats, so that's great to incorporate. You can also try your hand, experiment a little, and go meatless. Start with once a week, see if you can do a meatless Monday, and maybe lean towards more plant-based protein choices. Just to kind of stretch yourself, cut back on maybe some of that red meat intake and help yourself incorporate more plant foods into the diet. So, to touch on that, some healthier protein choices are going to be our lean meats, our chicken and our turkey. So thinking, the fewer the legs an animal has, typically the leaner it's going to be. Our omega-3 fish, again, salmon and tuna, cod and sardines also fall into this category. Our dairy products can be a great source of protein. Things like our Greek yogurt, certain cheeses like a cottage cheese, and milk can all help you meet your protein needs. Now, soy products like tofu, tempeh, and soy milk are also a high protein option, and they are plant derived, as are our legumes, our nuts and seeds, and even some of our grains have a little bit of protein in them as well. Now, those aren't going to give you as much bang for your buck as the animal products. So, if you are fully plant-based, you might have to be a lot more mindful and really educate yourself on how much protein is in some of these plant options and see what your protein needs are and how you can combine these foods to get enough protein every day. And did you know, speaking of meats, that grilling and high heat cooking methods can result in the formation of some carcinogens? So when you're grilling, maybe when you're blacking chicken and you're getting that black charring on there, that is the part that can be carcinogenic. How we can avoid or reduce this risk is to try to marinate or pre-cook our meats before grilling. Try to use leaner meats. Those typically, you can cook at a lower temperature. So we reduce a little bit of that high heat exposure. You can also scrape off or remove the charred meat portions. And then also grill your vegetables and your fruits. Those need to be grilled at a much lower temperature, so you're less likely to get that charring. So that's just a pro tip. I know that's not included in the American Institute of Cancer Research's 10 top tips. Okay, so now we're going to pivot and talk for a second about dietary supplements. I know this is always a hot topic, and I do want to preface by saying I won't be giving any individualized supplement recommendations today. This is really just to touch on, in general, the role that supplements might have in the cancer survivorship stage. So interestingly, 60 to 80% of cancer patients, so that's the majority of cancer patients, have taken supplements at some point during their cancer journey process, so either before, during, or after treatment. In a perfect world, we would be consuming our nutrients through a balanced diet with a variety of foods. So, again, eating that rainbow, like we talked about earlier, instead of taking megadose supplementation. The natural combination of fiber, vitamins, micro, and phytochemicals in our foods is what we think makes the biggest difference in cancer prevention and recurrence versus honing in on individual nutrients. So we do see that this appears to be more beneficial than taking individual nutrient supplements. We also don't have a lot of really great research backing a lot of the claims of certain nutrients on their ability to help reduce cancer risk. And of course, our supplement industry isn't regulated the same way that our food is regulated. So sometimes there can be extra things added to our supplement that might be harmful, or sometimes the doses can be a way too high of a dose that might have some negative health consequences. Not to mention, there can be some medication and supplement interactions. So some supplements that maybe you've heard are great or have certain benefits might actually interfere with some of your cancer or some of your non-cancer related medications. So, as always, we do recommend checking with your cancer care team, your oncologist, your dietitian, before taking really any of your supplements. And at the very least, you want them to be aware of what you're taking. That way, they can help you identify if there is a known contraindication or interaction that we want to stay away from. Now, with that being said, there are some supplements that might be worth discussing with your care team to see if it will be right for you. The top one is going to be vitamin D. We do find that many cancer patients are found to be deficient in vitamin D. So it's good to have our levels checked at least once a year. If your levels are low, the natural next step might be to take a supplement to help raise those levels. You can get vitamin D through food and sunlight, but oftentimes that's not enough to actually help raise our levels if we are falling in that deficient category. Another one that might be helpful is omega-3. We talked about the benefits a couple slides ago of omega-3 fish in the diet. If you struggle to get fish in the diet, you might benefit from the anti-inflammatory benefits of an omega-3 supplement. I will say you can also get some omega-3s through certain plant foods like flaxseed, chia seed, or hemp seed, or walnuts, to name a few. And another benefit is omega-3s have been shown to be good for cardiovascular disease. And there's some research that it can actually help reduce muscle wasting during treatment. Now, you might be past that treatment stage, but it's still a good thing to know about. We may also consider for you probiotics long term after treatment. This can help support a healthy gut microbiome. When our gut is healthier, we tend to have a better immune system. We also might have less mood related disorders like less anxiety or depression. We do see links between an unhealthy gut and those mood disorders. And it also might help with managing a healthy body weight. So again, you can get probiotics through your food, and it's really great to get enough fiber in the diet to help support probiotics, but this might be something we could consider in supplement form. Lastly is calcium. Bone health is a concern for many cancer survivors because a lot of the medications, short term and long term, can put us at higher risk of bone loss. And so we want to be mindful of that. In addition to weight-bearing exercise and getting plenty of calcium through the diet, we may need additional supplementation if you're struggling to hit your needs, or if your doctor is finding that your bone density is declining at a faster rate than they would like. So this is something that might come up in your conversations where you're talking with your oncologist about your bone density status. All right, so those are kind of the most common ones that we may recommend for cancer survivors, so good ones to keep in the back of your mind. Okay, so as you maybe have experienced or are experiencing, there might be some side effects after cancer treatment that pop up either short term in the initial days or weeks after treatment, maybe moderate term, maybe a couple months after treatment, and then sometimes even longer. So just to kind of help, we're going to go over a couple of the common side effects and some strategies to help combat them through nutrition. Okay, so first up is decreased appetite or early satiety, which basically means getting full quickly. When we're finishing up treatment, it might be still hard to eat enough. Again, maybe you experienced weight loss, or maybe food isn't appealing, you've experienced taste changes. A lot of different factors can contribute to decreased appetite. What we recommend to help make sure that we are getting enough nutrition in to support our needs is to pivot from eating 3 meals a day to 5 or 6 smaller meals. This can be a lot more manageable and keeps us from getting too full too quickly. You may not be able to rely on your body to tell you when to eat. You might need to schedule your meals and snacks instead. Unfortunately, after cancer treatment, your body's been through a lot, so it might not be the most reliable right now in communicating to you what it needs. So we want to make sure we're being mindful of when we're eating and how much, and really set an intention to eat when we know that we're going to need it. To make this easier, we recommend keeping your pantry and fridge stocked with foods that are going to make quick and easy meals and snacks. So thinking, maybe some single serve hummus and guacamole cups, or maybe it's, string cheese sticks that are already packaged for you, or pre-cut fruit and vegetables, things like that. You can also eat a bedtime snack. This will give you extra calories at the end of the day without affecting your appetite at your next meal, since the next meal is still, probably 8 to 10 hours away. And you may need to make every bite count by opting for higher calorie foods if eating 5 to 6 small meals a day is still a significant challenge for you. You can do this also by getting in some calories through liquids. Sometimes it's a lot easier for us to drink our calories than eat them. So choosing maybe some 100% fruit juices, maybe some milks, smoothies, protein shakes, those might help you to hit your calorie needs. At the same time, you might need to avoid eating and drinking at the same time. If you're getting full by your liquids too quickly, you might need to separate those. Okay, another common side effect that sometimes we see alongside decreased appetite is fatigue. Sometimes we're just tired because we just did 6 weeks of radiation therapy every day, or, we're trying to balance work with our cancer treatment. There's so many reasons why we might be fatigued at this stage in our journey. So, some tips that are going to help. Number one, make sure you're staying well hydrated. When we're dehydrated, it seems like almost all of the systems in our body run slower. So, staying hydrated can help make sure your energy levels are where they need to be. Again, try not to skip meals because food ultimately is fuel. Calories is a unit of measuring energy. When we're not getting enough calories in spaced out throughout the day, we might have some more crashes or, peaks and valleys in our energy level throughout the day. You may want to prioritize meal prepping or cooking in bulk on days that you have more energy. So Sunday's a good example. Maybe when you've been a little bit more rested on the weekend, you have more energy to go ahead and prepare some meals to set you up for success for the rest of the week. You may want to utilize grocery pickup or delivery to preserve energy at the grocery store. You'll also really want to consider physical activity if you have not already, as long as you've been cleared by your physicians to be exercising. What we see is that when we're able to be physically active, even if it's in small increments or very light, that can significantly improve our energy levels. The hardest part, though, is just getting started. I recognize when you're tired, when it's been a long day, the last thing you might want to do is exercise. But 9 times out of 10, you are going to feel better either immediately after the exercise or within a couple of days or weeks as you make this more of a habit. Yoga and other stress-reducing activities may also help. We have a lot of great research on yoga in breast cancer survivors being a beneficial part of their treatment and recovery. So that might be a way to ease into some physical activity, if that applies to you. Lastly, take it one day at a time and look at each day or even each meal, if you can, as a new opportunity to help fuel your body right, and to help fight that fatigue. Okay. Now, you also might have some decreased immune function after cancer treatment. So, when your physicians are looking at some of your blood cell counts, a lot of times that is correlated with our immune function. Now, unfortunately, we don't know of any foods or diets that help raise certain blood cell count. For example, we don't know of any foods or a certain diet that can improve our white blood cell count, which is directly linked to immune function. But what we can do is practice food safety and implement some diet and lifestyle habits that will help support your immune function. So some examples of food safety, making sure we're washing all of our produce really well under running water. Maybe we have a designated fruit or vegetable scrubber to get off any extra debris. We want to make sure we're not eating anything raw or undercooked. So now might not be the time to eat, sushi or to get a rare, a steak cooked rare out at a steakhouse. We want things to make sure that they're well cooked so that we have every opportunity possible to kill off any bacteria or foodborne illness. You'll also want to make sure you're keeping hot foods hot and cold foods cold. Once that you've, made your food, put it on your plate, try to put it in the fridge to store it before, maybe even before you eat your meal. That way we're keeping it out of the temperature danger zone as much as possible. We want to, or maybe need to avoid eating in crowds at this time too. This time of year, luckily, there's less illness, less flu and cold going around than in the winter and early spring. But depending on your immune function, you still might want to avoid eating in crowds. Try to take out and, take your food home instead, or maybe eat at restaurants kind of at off hours instead of at the busy points of the day. Again, this might just be temporary in those early days after treatment. Regardless, you'll always want to make sure you're practicing good hand hygiene. Wash your hands before food prep, before eating, to make sure we're not spreading any additional bacteria. And then, of course, consuming that balanced diet with as many micronutrients as you can, we do believe helps support immune function. When we're experiencing micronutrient deficiencies, we're more likely to catch sickness. And of course, prioritizing sleep and movement does help with our immune function as well. And I even notice I'm more prone to get sick in periods where I'm exercising less. I'm very rarely do I get sick when I'm exercising more. And it's the same for a lot of folks. So again, get that movement in, even if it is gentle or just small increments a couple times throughout the day. Lastly, avoiding smoking, so any tobacco products, as well as alcohol intake, can also help support a healthy immune system. We do see decreases in immune function with tobacco and alcohol use, so a good thing to keep in mind there. Of course, in addition to all the cancer fighting benefits of avoiding those products. Okay, so I did touch on this earlier, so I won't harp too much on this, but again, osteoporosis or bone loss is a common long-term side effect of cancer treatment. So we want to make sure we are including plenty of calcium and vitamin D in the diet. You will get most of your calcium through dairy products. It is the most bioavailable and easy for our body to absorb in our dairy products. You can also get a good amount of calcium through your soy as well. So soy milk, tofu, and tempeh are also very bioavailable in terms of calcium. Many of your dairy products are going to also be fortified with vitamin D to help you get that little extra bit. Other than that, our foods highest in vitamin D are more limited. It's going to be certain fish that have been exposed and hold on to UV rays from the sun. Similar to how we absorb vitamin D from the sun, certain fish are going to provide that for you. Weight-bearing exercise and physical activity can also help support bone density and prevent bone loss. That could be walking and jogging. It could even be climbing the stairs, or it could look like resistance and other, actually using weights in your exercise routine. Another benefit of being physically active is when we have more muscle mass or when we're practicing balance through our exercises, we're less likely to be at fall risk. And when we're less likely to fall, we're less likely to break a bone. So that's going to be really important, not only post cancer treatment as a survivor, but as we age as well, this becomes more and more important. And again, not to sound like a broken record, but avoiding tobacco and avoiding alcohol can also help with bone density. We do know that both of those things do contribute to faster rates of bone loss. So, as a reminder, what we recommend in terms of alcohol, best practice, of course, to avoid it altogether. But if you choose to drink, try to limit to no more than one alcoholic beverage a day for women and no more than two beverages for men. And then, of course, I didn't put this on here, but keep those conversations about bone density going with your oncologist. If it's not something that's come up, it could be great just to ask, hey, was my particular course of treatment one that is known to put me at higher risk of osteoporosis? They may say not. And then in that case, it's something that you might monitor with your primary care physician, just like how anyone who hasn't been affected by cancer would. All right, so we have covered a lot of information today. And before we wrap up and do some questions, I wanted to provide some additional resources if you want to look into more information on nutrition and the survivorship stage. All of these websites included here are going to be a great place to start. The American Cancer Society and the American Institute for Cancer Research provides a lot of the information that we talked about today. They've got a lot of great resources on their website. They even have some challenges, like a 30-day cancer fighting checklist. That one is great and would even be a great thing to do maybe with family or if you have other survivors in your life that you want to connect with by doing that. Of course, you can, if you haven't already, looked into nutrition counseling. I work for Northside, so Northside does offer oncology dietitians for patients who've been treated with Northside. The other major hospitals in Atlanta offer oncology dietitian visits as well. So, you can, if you're not sure where to look, if you're at one of those other hospitals, feel free to talk to your providers about initiating a referral, and hopefully they'll be able to help you set that up. And then lastly, again, next month we're doing the 4-part Reducing Cancer Risk series. We're going to go into a lot of this information a little bit more in depth. So today was a great starting point to talk about some of these things. So if you want to dive more in, but you're not sure you necessarily want to work with a dietitian right now or need that, then that 4-part series will be really helpful.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.